Now let's talk about lesson 5, which is effects of aging on the integument. So what happened in the integumentary system that there is a flattening of the dermal epidermal junction, which is the junction between the dermal and epidermal. So there will be a reduction in the thickness of the dermis. There is also a degeneration of elastic fibers, so the skin will be more rigid. So there is an increase also on coarseness of the collagen, so the collagen will be harder. There is atrophy of hair bulbs and decline in hair growth, and that's why you will see a lot of hair falling from older adults, or you will see them with less count of hair. There is increased fragility of the skin, which leads to skin that makes the skin more prone or vulnerable to damage and ulcers. Special care must be taken when caring for older adults, as they have a heightened risk for skin tears, so they are more prone to injuries. The increased fragility of the skin poses challenges to older adults and their caregivers, in that there are heightened risk for skin tears, easily bruising, ulcer formation, and skin infections. Okay, so one of the very important things that we need to keep in mind is detecting unhealthy moles. Unhealthy moles may be an indication of skin cancers. So it's very important for us to know how to assess moles. So number one, A, which is asymmetry. Number B, the border or the borders. So irregularity of the borders. C is the color and D is diameter. And we have a very nice guide to skin status, which is guide 28.1 on chapter 28. So please go through that. Our nursing assessment is to first identify the best opportunity with the most direct contact to assess the skin, and also to ensure that we assess unhealthy moles and report them promptly. Okay, so issues that you may face that may affect the appearance. Um, so So it might be very frustrating to have unhealthy or to have a lot of moles. So you need to clarify for your patient that these are a normal aging thing and they may not be unhealthy. So they are not always cancerous, but they may be, like moles that are appearing with normal aging. There are now a lot of cosmetic surgeries that can be done on these moles. However, if they are unhealthy moles, then you need to report them to the oncology team. Okay. Pressure ulcers is another problem that older adults may face. These are it comes with many types and stages. So stasis ulcers, which result from the leakage of blood from veins under the skin because of the stasis, and pressure ulcers, which are caused when perfusion to the tissue is impaired by external pressure that causes tissue injury and death or friction. Okay, so tissue anoxia, or what we otherwise called ischemia, results in necrosis of the cells and sloughing and tissue ulceration. So you should be familiar with the staging and common sites of pressure ulcers, which are presented on page 392 on chapter 28. And it may take longer healing periods because these patients are being affected again by the aging process and a lot of immunological changes, in addition to the presence of comorbidities or a lot of chronic conditions such as diabetes mellitus. Okay, so having a skin that is fragile and damages easily Patients may be also having poor nutritional state. They have also reduced sensation of pressure and pain in certain areas, and that's why they get ulcers. And they are more frequently affected by immobility and edematous conditions, which contribute to skin breakdown. To a lot of heart failure patients or patients with arterial or venous insufficiency may suffer from skin breakdown. Okay, let's talk about stages of pressure ulcers, but I want you to go in depth in your book. So stage number one, which is non-blanchable erythema of intact skin, which is involving only the epidermis, so it is non-blanchable. And then stage two, there is a partial thickness of skin loss involving the epidermis and dermis, and there is a shallow opening or blisters that are very painful usually because the patient can still um, feel the pain or there are nerve endings in these areas. Stage 3, which is full thickness or skin loss involving damage or necrosis of subcutaneous tissue that can extend deeply down to, but not through underlying fascia or moderate. So patients will be having moderate pain. Okay, because now it's away from the nerve endings a little bit. Stage number 4, which is the full thickness skin loss with extensive destruction and tissue damage to muscle, bone, or supporting structures. So for stage 3 and 4, wound dressing, which is coated with necrotic tissue, dissolving enzymes for wound debridement. So prevention is is a priority, and it all depends on nursing intervention. So frequent assessment is very important. We have a lot of tools to assess pressure ulcer risk, and risk for pressure ulcer formation is very high in among older adults, and that's why we need to use tools to assess pressure ulcers, such as Braden scale and like reassessing them on a daily basis is very important, or every shift even. There are some older adults that may develop signs of pressure ulcers even with a turning schedule of every 2 hours and require more frequent repositioning like every 1 hour, especially those who are having chronic conditions, edema, or they are more prone to ulcers. Okay, these are the most common areas of ulcers. Okay, so what do we do to promote a healthy integumentary system? So number one, avoid agents irritating the skin, promote activity. Okay, sweating is very good to the skin, and use of bath, oil, lotions, and massages. Avoid excessive bathing, which dries the skin, and use tepid bath water. Avoid hot water. Again, early treatment of pruritus and skin lesions is very important. Avoid exposure to UV rays. You know, to monitor for the conditions that can affect the skin, such as CVA, such as previous pressure ulcers, vision problems, hearing problems, skin diseases, falls, gout, osteoarthritis, rheumatoid arthritis, effect of, for example, how these conditions may affect on activity of daily livings and instrumental activities of daily livings. Again, anemia and poor nutrition may also cause ulcers. There are alternative therapies that we need to consider, such as herbs, or as for example herbal medications or herbal creams that are containing aloe, chamomile. We need to avoid cornstarch, which promotes fungal growth. Essential oils are good also for the skin, like aloe vera and application of chamomile extract for skin inflammation, for example, and burns. There are some nutritional supplements that may help the skin disorders as well as other immunological, boost the immunological function of the body, such as zinc, magnesium, fatty acids, and vitamins like vitamin A and B complex, B6, and vitamin E. And also in the hospital setting, we need to avoid betadine, hydrogen peroxide, alcohol also, because they can or they may damage newly formed. So we came to an end of this lesson, and our practice question says a 69-year-old patient is at a very high risk for pressure ulcer due to reduced sensation of pressure and pain. Which intervention to the nurse implement as a priority to prevent development of pressure ulcers in this patient? Or like option A, massage bony prominence every 2 hours. Option B, provide patient with diet rich in proteins. Option C, use pressure matters and frequently turn patient. Option D, keep the patient's skin clean all the time. Thank you so much for listening, and please find the answer to these questions in the folder of week 8. Thank you so much.